Hello everyone, my name is Nelson Padilla, and I will be discussing combat veterans coping with post-traumatic stress disorder, or PTSD. The articles that I will be referencing are Riggs and Sermanian, Prevention and Care of Combat-Related PTSD, and Grohol, Coping with Combat PTSD. My objectives will be to identify and discuss what is combat PTSD, discuss treatment of PTSD, and possible prevention of PTSD. Now, what is PTSD? As you see from the picture on the screen, it affected about 2.2% of the population in 2012. PTSD is a psychological mental disorder that affects anyone after surviving or living through a traumatic and horrific event. How does PTSD relate to combat veterans? Combat veterans experience PTSD as a result of being shot at, shooting at enemy combatants, or surviving improvised explosive device attacks. The first step in beginning the healing process is to diagnose whether or not you have PTSD. The author references how to treat PTSD. One of the best ways to obtain treatment for PTSD is by visiting the Department of Veteran Affairs, which offers the most extensive resources for veterans returning from war. While in combat, veterans have the option of seeing their medical professionals, or the docs as we call them, to obtain medicine to help subside or mitigate the effects of surviving a traumatic event. Chaplains, or padres, is a great source for treatment of PTSD, affording service members a spiritual guidance for treatment and healing of any of their PTSD stressors. Psychiatry and psychology. One of the best methods for treatment is talking to a psychiatrist who can help you with acute anxiety, depression, anger, or feelings of self-worth, shame, guilt, confusion, or any pain you may be experiencing. Now, my author references how to possibly prevent PTSD from occurring in the future. And one of the best ways is to provide decompression or relaxation time. As you see from the picture on the screen, the service members are engaging in what we service members know to be the best way to decompress: playing video games. According to the author, there should be medical screening provided to all service members wishing to join the military to determine if that person is more medically prone to acquiring PTSD. There is also a reference to individual counseling. Through one-on-one counseling, service members are able to release their anxiety and begin the healing process by talking with a clinical psychiatrist. Now, can someone name at least 2 events that trigger combat PTSD? What are at least 2 sources for treatment that I mentioned? And how do service members cope with PTSD? I agree with these points that PTSD is a plague in our military. Current treatment is not adequate, and that there is definitely no set cure for the treatment or prevention of PTSD. I disagree with these points that genetics is a useful screening method for service members, or that it should be used to eliminate service eligibility, and that PTSD can be completely prevented. I disagree because I am a clinically diagnosed veteran with PTSD. Should that mean that I would not be allowed to join if this was determined when I joined initially? And we do not know how any one individual will react to surviving trauma. The future research that I feel needs to be conducted is an extensive research in determining better medicine to treat veterans, because currently treatment is only done on a trial and error basis. And I also feel that we need to do research to determine what the long-term effects are of the medicines that we have been prescribed currently. These are my references that I use for my presentation. Please feel free to browse them at your own time to learn more about PTSD and how to help a service member cope with the effects of PTSD. Thank you.